We're talking about folliculitis, furuncle, and carbuncle. So you see folliculitis is an infection of a single hair follicle. So for example, if you look at the normal picture of the hair follicle, if the hair follicle was inflamed and infected, the most common causative agent would be Staph aureus, okay? But if it's a swimming pool and you get infected, it's probably Pseudomonas aeruginosa, which can be more transmitted in infected hot tubs and swimming pools. So how does it present? Folliculitis is inflammation of the single hair follicle, and it presents with these pustules, these little pustules. Furuncle is one step ahead of that. Now you have an abscess of the hair follicle. So it's a large suppurative abscess, and you can see it starts to get inflamed and pyogenic. That is the pus in the abscess. So if you look at the furuncle, that is the pus in the abscess, but still it's only an abscess surrounding one hair follicle, okay? This is again with a single hair follicle and a single point of drainage. That's how we differentiate a furuncle from a carbuncle. A furuncle still has a single point of drainage. They are both abscesses. So a furuncle and a carbuncle are both abscesses, but a carbuncle is now two or more furuncles together, two or more confluent furuncles, okay? These are suppurative abscesses. In this picture, you can see more clearly that a furuncle is an abscess and a red tender nodule around the hair follicle with a single draining point. A carbuncle is multiple with several draining points. Now it makes sense if you know that folliculitis was an infected hair follicle with a pustule. It presents as pustules, and furuncle and carbuncle were the abscesses, which means a pyogenic membrane contained within a wall. You know that furuncle and carbuncle would benefit from draining, so you would do incision and drainage as the surgical treatment, incision and curettage, which is cauterization. So essentially, folliculitis, what is the treatment? Oral antibiotics. You don't yet need a warm compress. Furuncle, you would do oral antibiotics like doxycycline plus a warm compress. Why do you need the compress? To help with the drainage, of this abscess. But remember, furuncle and carbuncle are abscesses, and you often do incision and drainage or anti-staph antibiotics if it's still early in the disease. So, and a carbuncle, you can see, just look at how they present. The folliculitis was with the pustules. Look at the picture. These are pustules in areas of hair, so it can occur in many different areas around the body, areas of sweat and abrasion. Furuncle is the same. It's a single boil, but a carbuncle is the worst progression of all. It's the most severe progression, and that one, you can just see how it looks. It looks like it has multiple draining points. And it would require incision and drainage as well, because remember, these have a high rate of recurrence as well. These have a high rate of recurrence.